Good afternoon. Welcome to the EMA office here in St. Clair County for day 663. For those of you who are keeping track of the week, it's week number 30. I'm joined here with County Board Chairman Mark Kern and Director of the Health Department, Mila Blanford. Mila, and our numbers are through the roof and
definitely the wrong direction.
Really, and we've said this before, but we're back to where we are or were. So
correct. For the reporting period of December 30th through January the 5th, we have a total of 4,249 new positive tests out of 16,382 for the reporting period. The age range of individuals is under 1 to in their 90s. The weekly county positivity rate is at 25.9%, with the 7-day rolling average match at 25.9%. The regional positivity rate as of January the 2nd was at 23.1%. Our case rate right now is 789 per 100,000 population. Last week we were at 435 per 100,000 population, just for a comparison of where we've moved in the last week. Unfortunately, we have 11 new deaths to announce today. We have a male in his 40s, 2 males and a female in their 60s, a male and 2 females in their 70s, 3 males in their 80s, and a male in his 90s. Countywide, we have conducted a total of 631,255 tests, consisting of 51,562 positives and 579,693 negatives. Total number of deaths to date is 608, and our condolences go out to those families. Statewide, we have conducted a total of 45,510,637 tests, consisting of 2,295,445 positives, which is an increase of 176,283 from last week. Total deaths to date is 28,156, which is an increase of 422 from last week. For St. Clair County hospitalization numbers, the number of COVID-related hospitalized patients in St. Clair County is at 128. Regionally, we're at 249. Patients on ventilators in St. Clair County is at 12. Regionally, we're at 23. And Randy, would you like to share the graphic from our hospitals for the week? You can see that we have 128 hospitalized patients. That's a comparison of 90 from last week. 82 are unvaccinated, which is about 64%. We have 18 in the ICU. That's up from 17 last week. 13 are unvaccinated, or about 72%. We have 12 patients on ventilators. Last week we were at 9. And 8 of those are unvaccinated, or about 67%. Randy, if you want to bring up the age graphic. You can see that we have about 7% that are in the 10 and under category, cumulatively 19% in the 20 and under, and 59.5% in the 40 and under age group. It's comparable to what we had last week, and we have some incremental increases across all age groups. For congregate care, announcing those that are in outbreak status, we have Aperian Care in Mascoutah, 1 new case. Brea of Belleville, 15 new cases. Bradford Place in Swansea, 2 new cases. Cambridge House of O'Fallon, 2 new cases. Cambridge House of Swansea, 2 new cases. Caritas Family Solutions in Belleville, 2 new cases. Caseyville Nursing and Rehab, 11 new cases. Cedarhurst of Shiloh, 8 cases. Cedar Ridge of Lebanon, 11 cases. Colonnade of O'Fallon, 14 cases. Freeburg Care Center, 11 cases. Four Fountains, 3 cases. Gateway Foundation, 1 case. Integrity Healthcare of Belleville, 11 cases. Knollwood Retirement Center of Caseyville, 1 case. Memorial Care Center, Mercy Rehab and Care Center in Swansea, 10 cases. New Athens Home for the Aged, 4 cases. Silver Creek, 3 cases. St. Paul's Home, 9 cases. Sycamore Village of Swansea, 1 case. And Willow Creek of Belleville, 5 cases. We continue to see increases in cases across the state and in our area, as well as our local hospitals, as the data shows. Illinois Department of Public Health has adopted CDC's recommendation for a shortened interval between receiving the Pfizer primary series and that booster dose, so from 6 months down to 5 months. In addition, Pfizer third doses have been approved for children in the 5 to 11 age group, We do recommend that parents talk to their healthcare provider. So that's a third dose for children who are moderately to severely immunocompromised. So again, have that talk with your healthcare provider. You can contact the health department and we can provide that vaccine, 825-4442. We're still looking at booster doses for the 12 to 15-year-old age group. ACIP is meeting as we speak to discuss that. So we should have some updates coming in the very near future. In addition, we know that CDC adopted the new isolation and quarantine guidelines, as did IDPH this week. So those are out on our website. I know we discussed that last week. And as we also talked about, the Vax Verify system now has two components, one where you can go in and print all your immunization records, and another has the Vax Verify card with the QR code that you can have scanned for your COVID-related vaccines. Okay. Chairman?
So, Mila, you know, we've been at this for 663 days,
Yes.
and this is the highest positivity in the county that we've had the entire time, going even back to the beginning when we were all, you know, when this was still a mystery to us and the numbers were growing. Is this variant is just far more contagious?
Right. We do see it spreading much more easily. There's some debate on the severity. In the ACIP talk today, they were talking about it affecting the immunocompromised more severely. Those are the ones you're seeing hospitalized. So there's still data out there that they're working on, and I think there's more to come on what we determine.
And on our vaccinated, unvaccinated numbers on the hospitalizations, there are degrees of vaccination. And so we really want to make clear to people that you need to be fully vaccinated, which means you need to get the 2 doses. And then when it's available for you, because of the time length, you need to get that booster.
Right. So if you're moderately to severely immunocompromised, you've received an organ transplant, you're a cancer patient, they recommend that you get that primary series and then a third dose. And then if you're, you know, not severely immunocompromised or moderately, you get that primary series and then you boost that at 5 months if you had Pfizer. Right now Moderna is 6 months. We could see some changes coming down the road with that as well.
And we're still offering those at 330 West Main Street.
Yes, we are.
Give the times and the dates again, just so everyone's clear when it's available for them.
Sure. So at 330 West Main, we offer all 3 types of vaccine, Monday through Saturday. Monday through Friday, we're there from 10 to 6, and Saturday from 8 to 4. The 5 to 11 age group, though, you do have to receive vaccine at the health department, and you do have to have an appointment for that. You can call 825-4447 or go to our website to register. In addition, St. Clair Mall offers testing Monday through Saturday now from 8 to 4. And Monday, Wednesday, Friday, Saturday, they offer all 3 types of vaccine, not for the 5 to 11 group, but for the older ones. And again, that's available from 8 to 4 on those specific days.
And 330 West Main, do they need an appointment?
No, they can just drive up or they can register online, whatever they're more comfortable with.
Great, and it's free.
That's correct.
So we encourage everyone to get out.
We certainly do.
Thank you, Mila. I know you've been really busy and your staff's been busy,
Yeah.
and it's greatly appreciated. We've got to get through this. And
We appreciate all those health department workers who are tirelessly working to, you know, to tell people, educate them, answer questions, and you know, we want to get to the other side of this as much as anybody else does. I did see a letter in the paper over the weekend from the hospitals to residents, you know, urging them to get vaccinated and take care of themselves. So.
And I think the hospitals now, some are going to canceling elective surgeries.
Correct.
Which is just, it's the numbers that we show in the hospital, 249 regionally that are in the hospital now, 23 on ventilators. It's the hospitals are just, I don't want to say overwhelmed, but they certainly are full of these COVID cases now. So we need to also be thinking of our doctors, our nurses, our frontline workers, the dispatchers. All of our emergency personnel are really putting in extra time. And these numbers are going to show you why. So let's take a look at the zip code report for the week. In 62059, we went up 3 to 79. 62201, we're up 79 to 1,055. 62203, up 117 to 1,194. 62204, up 85 to 820. 62205, up 111 to 1,247. 62206, up 273 to 2,585. 62207, up 119 for the week to 1,247. 62208, up 343 to 3,140. 62220 up 334 to 3,651. 62221 up 542 to 5,026. 62221 breaks that 5,000 level today. 62223 up 260 to 3,116. 62225 up 66 to 422. 62226 up 570 to 5,622. 62232 up 120 to 1,536. 62239 up 63 to 902. 62240 up 8 to 286. 62243 up 68 to 1,195. 62254 up 72 to 1,205. 62255 up 11 to 165. 62257 up 20 to 567. 62258 up 154 to 1,810. 62260 up 64 to 1,243. 62264 up 43 to 649. 62269 up 579 to 6,021. So 62269 breaks the 6,000 level today. 62282 up 11 to 103. 62285 up 57 to 926. And finally, 62289 up 6 to 90. Regional positivity is up to 23.1%, and the county 7-day rolling average is up to 25.9%, the highest we've ever seen. Also, I think the Shrine, someone just texted, the Shrine went up 3 cases. They're now at 70 cases and 11 deaths. Herb, difficult loss this week. George Chance, member of the 911 board, a longtime supporter of the operations here, of the dispatchers and the process. George was mayor of Caseyville for many, many years, and just a fine gentleman, and we hate to lose him in our county. He was certainly a good friend to this county for many, many years.
Yeah, was a pillar of the community, the county, and he's going to be missed. And like I said, it's unfortunate, but it was a terrible thing. We love George serving on our board, and he's going to be missed. So, but we have to go on, and that was one thing he always admired of what we've been doing over the last couple of years. He'd always call every day, checking on the stats and if there was anything he could do on his end. So
he did a lot.
Gonna miss those calls, but 663 days. Milo, one of the concerns the media caught on this week was the home testing, and there's some comments on here today about how are we reporting those numbers, and we clarified that with the news media. But again, why don't you take a minute and explain to our followers that what the process is for those home testing.
Right. So for home tests, if you test positive, you should follow your isolation guidelines that we have out there. Notify your close contacts, they should quarantine. If you need a letter for work, we would advise you to go get tested at one of the documented facilities here, so it comes through the state system, and we can provide you those letters that way. I did see that some of the Missouri areas have a portal you can enter. We don't have that yet here in Illinois.
Yeah, there was 2 in Missouri that are doing it that way. Mm-hmm. But some of the concerns that they're talking about is how are these numbers correct? We're doing the best reporting that we can. Right. So we can only report on what we've been getting.
Correct.
Is that correct? So yeah, the numbers are going to be different.
And home test is a useful tool, a great tool to have, but you're not always certain that that some people might report they're positive when they really aren't, just to try to do whatever their agenda is. And the same is true with the negatives. Right. Are we going to have home tests that are negative when we're not sure how people are really doing the test, if they're doing it correctly. So we use the numbers that we believe are the most correct numbers, and those are the ones that are administered by the state at St. Clair Square. They're administered by the hospitals, by the local healthcare providers that exist, whether it's an urgent care, whether it's another facility where there are qualified people who are doing it. That's not to say that home testing isn't a great tool, but it's just not the tool we're going to use to provide those numbers in the county. We can assume, and I do assume, that the numbers of positives in St. Clair County are much greater than what we're putting forth here. It just, we know that to be a fact.
And that's the point I wanted to make up, because one of the comments was, how can you report those numbers and not knowing the home testing? That's a very true statement. We can't. And as you're saying, some people may fudge on them, but the numbers that we are getting are the ones that are coming from the certified people. That brings up the other case. This week there was a big bustle about the pop-up tent that showed up out at the St. Clair Square Mall that everybody assumed was a fraudulent site. Nobody knows if it was. The Fairview Heights Police Department investigated that. They didn't have permission being there, but that stirred up some concerns about the site that's there from the state, if it's legit, which it is. The site has been there, it's been running, and we've been out there all week with them. And the site is, they did over 1,000 more tests yesterday.
And you can go to our website, Facebook page, and find those testing centers that are documented. If you're going out to a location, ask the individuals what lab they're affiliated with, who's going to be reporting their results to them, and when they can expect those results. Right. And there's been some articles, I think, in the local paper that go over those points. And
what happened with that pop-up site is that some of the citizens, when they started reading the paperwork and they were asking for Social Security numbers and more pertinent information, and that were really being good citizens who spotted that and said, "No, this don't sound right." So we appreciate that. And but back to these numbers, as the chairman read off, all zip codes in St. Clair County had increases, all 27 of them.
And if people are concerned about the number and say, well, you need to be adding the home testing in also, this number of 25.9% positives shows us that it is here, it is in the community in a big way, and now's the time we need to, we've needed to do it for 663 days, but this number is the highest it's ever been. So let's be extra vigilant. If you have not been vaccinated, get vaccinated.
We're about 60% in the county. That number can definitely go up.
There's a lot of room to go up, as is evidenced by the number of hospitalizations of people who are unvaccinated, people in the ICU who are unvaccinated, and people on ventilators who are unvaccinated. There's a huge number of people that still can get out there, get this vaccine in your system. It helps you. It certainly keeps you from getting getting in the hospital. It will make it less of a chance that you'll be in the hospital, less of a chance you'll be in the ICU, and less of a chance you'll be on the ventilator. And the power's in your hands.
Exactly. The power's there, and it's been that way, and so everybody has to take that responsibility. 660 some days ago when this was just beginning, nobody knew. There's still a lot out there that's not known. It's science. There's still every day something is changing. The one thing that we can sit here today and tell you is the best tool that we have in our toolbox is the vaccine. And to get tested if you feel like you've been exposed, if you're not feeling well. If you do your home test at home and you aren't feeling well, you have symptoms, call your local healthcare provider and follow their instructions just like you would if you had some other type of illness going on. That's always amazed me. We'll run to the doctor for this or that, and they put us on medication. We run to the drugstore and get the medicine. But when the doctor says, go get the vaccine, I got to go research it and see if he's right. So follow your medical provider's advice, and you won't go wrong, and you'll be helping be a part of the solution. If anything else comes up between now and next week, we'll let you know. But if not, we'll see you back here next Wednesday afternoon at 3:30. And everybody, please, if you haven't been vaccinated, consider doing so. Thank you.